Hi, NARC Troopers. Today we're going to talk about labels, and we're going to talk about how important it is to distinguish between different diagnoses. Some people say, what difference does it make if the partner that you've been involved with is a narcissist or a person with antisocial personality disorder, also known as sociopathy, or whether they're a psychopath? Does it really matter? The point is they were terrible and they're gone. And the answer is yes, it absolutely matters. It matters what the diagnosis is for both them and for you, so that you can know what you're dealing with, what to expect from them, what to expect during the healing processes following a relationship with a person like that. All of it, even your family, your children need to know the correct terminology for the correct problems that this person in their life is experiencing or has experienced. So the cluster B disorders, narcissism, sociopathy, and psychopathy, also include Machiavellianism, sometimes borderline personality, even though that's kind of not quite as popular to call it that anymore. But just like you don't call sociopaths, you call them people with antisocial personality disorder. It's just, it's a matter of terminology, but those conditions tend to overlap with each other, the cluster B. And your narcissist and your, I'm going to say sociopath because it's just so much shorter and will get us through this quicker. They are made, not necessarily born. Genetics could play a role. What happened in vitro in the womb sort of is like epigenetics. Epigenetics is sort of a scripting before birth for what kinds of health issues or problems that you could have after you're here, after you've arrived. So there could be some genetic components to that gives you a predisposition, sort of like if your parents were both alcoholics, then you have a chromosomal likelihood to be more predisposed to alcoholism than a person who did not have that disease in their family, because it is a disease, just like diabetes or high blood pressure, something like that, and there is that hereditary component. So that's part of it, but if you're a narcissist or sociopath, more than likely you developed this after you were born due to some kind of trauma, abuse, neglect, something horrible happened to you, and it triggered this. Narcissism and sociopathy is a trauma response. And that's kind of what we need to remember about that. So that's one category. Psychopaths are born. Perhaps something happened. It's genetic. Perhaps it's been speculated, not proven, but speculated that it has some connection to fetal alcohol syndrome, or like the results of the parents using opioids, or maybe being a meth baby or a crack or cocaine baby. There's a lot of different things that could have happened before birth that sort of scripted that person to be a psychopath. And what all three of those have in common, and they do overlap, each one exists on a spectrum of, having a light case to like being so consumed that it's debilitating, and so much so that it prevents them from functioning in a normal or healthy way. So it all exists on a spectrum, and sometimes within that cluster B, they overlap, and you've got a narcissist who is also a sociopath, or you have a narcissist who is also has tendencies to be a psychopath and has some of those qualities. There's common denominators for all three of those: lacking empathy, compassion, mercy, feelings for other people's pain, connection to others on an intimate level, the ability to accept responsibility for their actions and be culpable and accountable for what they do and the consequences that follow. It's never their fault. They always blame someone else, even if they have to completely reinvent a complete new narrative. That's just they're incapable of accepting responsibility or being self-reflective or learning from mistakes. They are entitled, arrogant. There's lots of different kinds of narcissists. There's different kinds of the others too. Some can be violent and can be deadly. Others can be more passive-aggressive and more vulnerable. They call them vulnerable narcissists, the covert narcissist, compared to the malignant narcissist or the overt narcissist. You see, there's many different kinds, many different labels, and it's important to understand them. As far as personality disorders go, this type of, and it is a mental illness by all definitions. It's on the DSM chart. This mental illness, you could have personality disorder cluster A, which has to do with schizoid disorders and other sort of eccentric, weird behavior, erratic, maybe hallucinations, delusions, things like that. Keep in mind, all of these personalities disorders in cluster A and B, and to some degree maybe in C, are reactions to trauma. They're trauma responses in some way. And a lot of times, even though there's a genetic part of it, they're also, how do I want to say it? Both A and B, and sometimes C, could be considered, I don't want to say that. I want to be careful that I'm saying the right thing here. Okay, I'm going to hit pause on that and come back to that, because I don't want to make a statement that has not been proven to be researched and true, fact. But I'm just going to give you like a touch of what I was going to say. They're delusional disorders, and cluster B definitely has to do with delusions. They live in a magical reality, alternate universe with a completely different set of rules. They have magical thinking. They are not rooted or grounded in reality, and they do not experience life the way you do. So what I was trying to say is that, sometimes you could compare that delusional piece of that to the cluster A people in the schizoid categories, because they are also delusional, but their delusions are different. And I'm having a hard time telling you how they're different. Just know that they are, that it's a different kind of lack of being grounded in reality, a different kind of disconnect from reality. And then cluster C would be more like attachment disorders, obsessive compulsive disorder, things like this, where the motivator here for cluster C is fear and anxiety. And back in the 80s, I was diagnosed with cluster C personality disorder by one of the first therapists that I ever saw back in the 80s. I think this was 1983. And it continued through 1984, 1985, that therapist, and it was explained to me that fear is the motivating factor because of an unstable relationship with parents in the formative childhood years. If you're cluster C personality disorder, you don't form those healthy attachments where you feel safe. And so through your whole life, you carry a very fearful, anxious attachment style. And you read a lot about that these days. You have abandonment issues, and you're just terrified. Your inner child is fearful all the time. So as the years went on, and I didn't go to therapy for a couple of decades, I ended up back in it again here a little over a year ago. And same thing was said to me. Same diagnosis. And I had not said, hey, I've already been diagnosed with this. I just talked about it because I wanted to see if they concurred, if they came up with the same thing. And they did. They without ever mentioning the previous diagnosis, just from going through symptoms and talking to them. One of my counselors, therapist, who was not just a social worker or LPC, licensed professional counselor, but an actual psychiatrist. Yeah, I went for the big guns. This was about 6 years ago. And she said, I've never met anyone that I can think of that is so fearful as you. She said that is at your core, and it motivates everything. And that is what is the catalyst or the impetus for all of your obsessive compulsive attachment disorders and, acting out of fear, acting out of feeling that you're going to be invisible and cease to exist unless you attach yourself unhealthily to another individual. And this is like a whole different category. Yes, codependency is a very common, popular term that everybody knows about what it is to be codependent, but this is not the same thing. Being codependent does not mean that you have a cluster C personality disorder, or the other way around. Just because you have a cluster C disorder doesn't mean you're codependent. I am both, but more cluster C is the primary root systemic cause of my problems, and the codependency comes from other things, like a lot of people that are adult children of alcoholics, for example, are codependent, and they set up that same dynamic in their adult lives with their partner that they experienced with their own parents who were alcoholics. They will often marry alcoholics, and things like that to try to live out that same dynamic. And so that's a kind of being an enabler, being codependent, that kind of relationship. It's different. They're not the same thing. And we're not going to get into that, but we're talking about two different things here. Please note that. And so when people start playing armchair therapists and they start reading a bunch of stuff online and thinking that they know something, a lot of times they get a superficial understanding of what's going on, but they don't really have a deep enough understanding for it to really be of benefit to them. I believe that we have to really know what's going on, and to do that, you really need therapy. You really need a therapist to name what those things are, to name them, to stamp them, to label them, to validate them and say, yes, this is what is your problem, and these are the things that you can do to ameliorate that. To have like tools that you can use to self-manage, to do self-care, to self-parent, to self-partner, all this self stuff, right? I love that because all those words are descriptors that tell you important things that you need to do as you're in recovery, trying to become whole and healthy and trying to get past these childhood wounds and these childhood toxic scripts, that you're just acting out this script that was given to you at an early age. You got to stop that, because the problem is you pass it on to your children unwittingly, unknowingly, because you are recapitulating a pattern of behavior that you learned when you were a child. Then you unknowingly impart that same toxic destructive pattern to them. And then there's years of therapy for them that they have to pay and sit through and try to wrestle with, to be able to make sense of why they have anxiety, why they're having depression. And then let me say one final thing. Sometimes you read about, as the adult child of, why do I have depression? Sometimes you'll stumble upon an article, it'll say, well, maybe you have a parent who's a narcissist, and they'll give you some kind of, because the whole narcissist thing is huge. Everybody talks about it. It's trending. Everybody's a narcissist. Everybody thinks everybody else is a narcissist. And that's not true. Everyone is a narcissist to some degree. It's healthy to have some narcissism or some narcissistic qualities. However, the important thing to remember is that you have to know when it crosses over from the healthy on the spectrum into the more maladaptive, destructive, toxic, personality disordered mental health issue, where you are impaired and it becomes a mental illness in a sense. You have to know where it goes from one to the other, because that's exactly what it does much of the time. So when you see some qualities, and you try to self-diagnose, I have that, my parent must have been a narcissist. Everybody's not a narcissist. More than likely, did you know there's something called the dark triad? Did you know that maybe they were just depressed and they have a depressive disorder, manic depressive, for example, and it has nothing to do with a personality disorder like narcissism, and that can script you for it? Did you know that there's probably a billion other causes for why you might be depressed that comes from your childhood, that comes from the way that you were parented, but has nothing to do with a personality disorder? You can't just go through a checklist and tick a bunch of boxes and say, yeah. Here's an important thing to know. When you're talking about personality disorders and the children of people who grow up and become adults and who look back at their parents and say, wow, now we have all these problems and it happened because of you. Many times, whether they're cluster A, B, or C, personality disordered people, as a rule, have adult children who have higher anxiety and more struggles with depression than the general population at large. I'm going to say that again. All adult children of people with any personality disorder, whether it's A, B, or C, will experience higher levels of anxiety and depression than those of the regular population that are neurotypical, average, normal people. They have a way higher. I don't have the numbers. I don't have them in front of me, but I've seen them, and it's a significant spike, increase. But all personality disorders are not the same. They are, even though the way that they are impactful on that person's children could be similar, the personality disorder itself is extremely different. For example, the narcissist, sociopath, psychopath, that person who is incapable of having genuine, authentic emotions, period. Just none. The only emotions they have might be frustration or envy or something like that. But as far as having real human emotions of compassion and empathy, intimacy, knowing what love is, they don't. They do not have that. And because they are not capable of that, then that defines that particular illness, the mask that they wear, the different types of narcissists who do different things, the way that they interact with people, manipulate them, the way that they seek fuel, the way that they seek character traits and personality traits from other people, the way that they're always seeking residual benefits from other people, and the way that they cover it up and they don't show you what's on the inside. They don't show you how they have a deficit, how they are bankrupt of human emotions. You never get to see that because they're mirroring you. For example, those specific markers, those specific characteristics are specific to people in cluster B. Cluster A, that's not how that works. They don't have those characteristics or symptoms at all. And cluster C, which is what I am, I don't have that. I don't wear the mask. I don't manipulate. I don't need fuel and um, and character traits from other people or residual benefits. I am not a opportunist in that whole narcissistic, sociopathic kind of way. I don't prey upon victims to use them and to make myself be more human. What I do is I attach to individuals and feel very deeply, almost the opposite for cluster C. You feel too much. It's not that you don't feel anything. You feel too much. And there's no healthy boundary. And your whole meaning in life comes from the happiness of the person you're attached to. So if that person is happy, then you're happy. And none of those characteristics that I'm talking about right now that I have from cluster C have anything to do with the characteristics from narcissism. If anything, they're like polar opposites. One feels nothing, the other feels too much. One uses people to be validated. The other is validated through making the other person happy and vicariously, attaching and experiencing the goodness together. Totally different. I hope you can see that. So it's very dangerous to start trying to ascribe and assign labels to people, when you don't know. I have a master's degree where my second focus of study was guidance and counseling. I've had all of this courses that, the training, and I've gone to many trainings and seminars and certifications for recovery from cluster B disorders, narcissistic abuse recovery, trauma bonding, trauma recovery, PTSD recovery. I've been to the trainings. I did the hours. I bought the workbook. I finished the training, and I've done that for many different areas and modalities for different treatments of PTSD and healing from this horrible thing as well. So I just want to stress to you today that it's important. When somebody says to you, does it really matter if your husband was a narcissist or a sociopath or a psychopath? Does it matter if he was that or if he was a cluster A schizoid person with a schizoid disorder, or maybe he was bipolar, or maybe he was borderline, or maybe he had a cluster C attachment disorder, or maybe there was nothing wrong with him. Maybe he was the picture of mental health and perfectly normal, neurotypical, average kind of guy. No. That's not going to help you, the person who got tangled up with that narcissist, sociopath, or psychopath. It is not going to help you recover if you don't know that's what that is that you're dealing with. Because the way you recover from a relationship from some other kind of person is a whole different kind of recovery with different vocabulary, different symptoms, different recovery techniques, different ways that you maneuver through it and recover. It's different as night and day. They are not the same beast. They have very few things in common. So you have to know what they are. You have to know what your own problems are that you're dealing with. You need to know those things so that you will know exactly how to move forward and what things you need to work on and what things you need to do and what things were wrong with them that made them do what they did and why you can't take that personally. Because if you understand what they are, you know that it's not about you. They're acting out a whole other script that they got from childhood that is about their childhood trauma and wounding that they got at the hands of their parent that they are trying to punish and murder. And they murdered themselves. They committed suicide when they were just young children. They killed themselves, and now they're killing their mother or father or whoever was the transgressor that violated them and traumatized them in childhood. They are punishing you. You are the proxy. You are that proxy parent for that narcissist, the sociopath, or psychopath, right? As a cluster C, I don't do that. I'm not trying to punish anybody. I don't need to murder anybody. I've thought about it a few times. When it comes to do with my sociopath, psychopath person, I don't even like to say the word narcissist anymore. It's so overused. I call my ex a narcopath because that's exactly what he is. He has two. First of all, he was diagnosed as a narcissist, but I think that because of other things that he said, did, and qualities he possessed, that he's not just a narcissist. He is also, on some level, somewhere on that spectrum, either a sociopath or a psychopath. Hence, I came up with the word narcopath. I didn't come up with it. You see that word all over the place. Other people, smarter than me, came up with that word, narcopath. They came up with it, and they use it, and it is an apt term. It's a good term because it shows you how those things blend. You can stop saying narcissist because everybody's tired of hearing that. It's almost like it's so overused. It's like crying wolf. Nobody believes it anymore. It's real, and it's really important that you know that it's real. And if your person has some sociopathic or psychopathic tendencies, let's just call them narcopaths, because that way you get the whole nice little cluster B package all together. Narcopath. That covers all three, and probably they are at least parts overlapping so that it is hard to distinguish one from the other sometimes. I hope this helps you. The sun was in my eyes through the first part of this video, and I could see you, but I bet that it was probably reflecting off my glasses. I'm sorry about that. You don't need to see me anyway. You need to listen to me. You need to know what your ex was and study that, research it, do a deep dive. Don't just read a Psychology Today article and think you know it all. Read a lot, study a lot. Check your sources to make sure they're legit. Really learn. There's so many great sources. I like Sam Vilknin. I think he's Russian, and he's an expert on this stuff, and he's really good. I've learned a lot from him. Melanie Tanya Evans, based in Australia. I love her work. I've bought her recovery program. I use it. I love it. I recommend it. Melanie Tanya Evans. Kim Saeed, I love her. She's got that whole Southern thing going on, and makes me feel like, I'm from Texas, and so it's like hearing, somebody from the South talking to you about what you need to do. Kim Saeed. Dr. Romani is another one who knows her stuff. All of these people are also on YouTube. All of these people have wonderful videos, better than mine, because they're professional, polished, syndicated, like the real thing. And this is just me talking to you because I care about you. I don't want you to suffer. I don't want you to be ignorant. I don't want you to be a victim. I want you to own your life and be whole and healthy. And I want you and your friends and your family and everybody to understand what this stuff is, to know about it, and to know that, yes, final message, if anybody ever says, does it really matter to know what they are or what their mental health issue was? And I say, hell yeah. Yes, it matters. It matters so much. And it matters to know what's wrong with you, too. Because, a normal person probably that was like the picture of health would have seen the red flags and have run away a long time ago. But you didn't. You stayed. I stayed for almost 16 years. And that shows you I've definitely got some things I need to work on. Yeah, we all have things we need to work on to get better. So let's not shame and stigmatize this thing. There's no shame in having a mental illness. There's no stigma to it. I mean, I know there is, but there shouldn't be. It's like, would you shame or stigmatize someone who had diabetes or heart disease? No, you would not. And this is no different. So that's what we're talking about. That's what we need to learn about. And that's what we need to just open up and say, yeah, I'm in therapy. Yes, I'm learning about this. Yes, I pay for, I have 2 therapists right now for myself. Even though I know all this, I still have 2 therapists. One of them is through Better Health I'll plug them for you. Turned out pretty good. I got a pretty good therapist who is helping me with EMDR. And then I have another one through my Blue Cross Blue Shield insurance provider, from a different clinic with healthcare, mental health providers there. So I'm getting like a double dose, and it helps. And it helps to know what this is and how to treat it and how to move forward. And there's no shame to say. I'm not ashamed to say that I have some of these issues, that I have a cluster C personality disorder and I'm codependent and I'm an addict. Part of it is that you have addiction issues. When you have cluster C and codependency, you're sort of an addict. Yep, you're a junkie. I'm a junkie. I'm a love junkie. Of all the different kind of junkies I could be, pill junkie, heroin junkie, whatever, sex junkie, whatever. I am happy to say I am not any of those junkies. I'm a love junkie. It's probably, that's probably one of the messiest ones to have, but, hey, it's better than some things that might kill you. Well, actually, being a love junkie could probably kill you too, but you get the message. So don't let people tell you this doesn't matter. You need to learn about it, know about it, get busy now, get started, be curious, find some answers, have some understanding, and then move forward from there. Okay, that's it. Have a great day. Bye.